Hi, I'm Dr. Kosubevsky here at the Osteopathic Center, and this is going to be a little video that talks about myself and how I got into the field of regenerative medicine. So it all started when I was about 10 years old, and my dad, who practices a form of manipulation extremely similar to osteopathic manipulation, started training me in manipulation. At first, he started teaching me on family members and eventually transitioned me to patients of his that were okay being worked on by me. And over time, I got better and better under his tutelage, and he started sending me to courses when I was about 18 years old up in New Jersey, and that further increased my knowledge base. So I've been doing manipulations for more than half of my life. And then when I transitioned to medical school, I started taking classes in anatomy and osteopathic manipulation, and those really ended up being my absolute favorite classes. While I was in medical school, I became the lab assistant for the osteopathic manipulation skills classes, and I taught the lower classes for about a year and a half alongside the professors. After that, I transitioned over to medical school rotations, where I met a physician in Miami who mostly did steroid injections, and he'd been doing steroid injections for probably the last 40 or 50 years on variety of patients, mostly agriculture and farm workers and laborers. And he was seeing these patients, a majority of them were repeat patients, and he'd see them every 2 to 3 months like clockwork, and he'd do steroid injections on their complaints. And the patients would leave happy, but ultimately they would come back every 2 to 3 months. So about halfway through my time with him, I met Dr. Goddard, who started introducing me to regenerative injections, specifically prolotherapy. And what happened was that I took the knowledge that Dr. Goddard taught me in prolotherapy, and I went back to the other physician, and we started doing prolotherapy on the patients that were open to the idea of it. And as we did more and more prolotherapy out there, what we started to realize was that the patients that used to come in every 2 to 3 months no longer came back. What happened was that instead of bandaging their symptoms with steroids, reducing their inflammation, but really not fixing their problems, the prolotherapy started treating them and actually resolving their complaints, fixing their issues. So these patients stopped coming back. They were getting better. So I spent about 9 months with that doctor, seeing about 20 patients a day, every day. Overall, I saw well over 1,000 patients with him. More than half of that ended up being prolotherapy patients. After my time with him, I transitioned to be under Dr. Goddard's tutelage full-time. Over the last about 2 years, I've been training under Dr. Goddard. He's taught me regenerative injections, he's taught me prolotherapy, PRP, bone marrow and adipose stem cells, and amniotic allografts. At this point, I've injected probably everywhere in the human body. I've done cervical injections, thoracic injections, lumbar injections, shoulders, hips, elbows, knees, ankles, you name it, I've injected it. The only thing I have not done is intradiscal injections. So Dr. Goddard started teaching me, and he started sending me to courses. So I've been to courses with Hackett-Hemwall prolotherapy, RMTI regenerative medicine, focused on the bone marrow and adipose and PRP. I've done ACAM, American Chelation practitioners. I've done American Academy of Stem Cell practitioners. So I've been to a wide variety of courses, all focused on making me a better practitioner, increasing my skill base, and increasing my knowledge base. So when I transitioned over to residency, I actually brought over prolotherapy and an ultrasound curriculum to the residency. And my residency was done out in Belle Glade, where, again, the majority of patients I was seeing were farm workers and laborers who were also coming in like clockwork for steroid injections. And they've been coming in for years. And what happened was that I brought over prolotherapy and I started treating these patients. And a lot of patients that were coming back all the time, I took over their care under the supervision of the residency doctors there, and I started doing prolotherapy out there. And what happened was these patients stopped coming back. Once again, they were getting better. Their symptoms weren't coming back every 2 to 3 months because we were fixing their issue. So along with being trained on all the regenerative musculoskeletal injections, Dr. Goddard has also taught me the cosmetic injections. He's taught me the vampire facelift, the vampire breast lift, the P-shot, the O-shot, and the hair injections. Actually, Dr. Goddard has trusted me enough that I have done facelift injections and hair injections on him. So overall, the biggest benefit of coming to be seen here at the Osteopathic Center is that we have a team of physicians here. And what happens is that every patient that comes in We all get together and discuss every single patient that comes in. We use our combined knowledge base, our combined skill set, and our combined experience to maximize outcomes for every single one of the patients that we see here. And this team is led by Dr. Goddard, who has well over a decade of experience in this field, and all of us all together have well over 20 years of experience combined. And so that's really is the biggest benefit of coming here. That's it.